Abdominal aortography with digital subtraction angiography. Abdominal aortography with digital subtraction angiography is a procedure that uses X-rays and a contrast dye to create images of the abdominal aorta and its branches. This helps doctors diagnose and monitor diseases related to blood vessels in the abdominal region. Conditions that can be diagnosed using abdominal aortography. Abdominal aortic aneurysm. This is a condition in which the abdominal aorta bulges out, which can rupture and cause life-threatening bleeding. Conditions that can be diagnosed using abdominal aortography. Abdominal aortic stenosis. This is a condition in which the abdominal aorta narrows, reducing blood flow to the abdominal organs and causing symptoms such as leg pain, weakness, and numbness. Conditions that can be diagnosed using abdominal aortography. Arteriovenous malformation. This is an abnormal connection between an artery and a vein, causing problems with blood circulation. Vascular tumors. These are growths in the wall of the abdominal aorta. Conditions that can be diagnosed using abdominal aortography. Underdeveloped vessels. This is a condition in which the abdominal aorta does not develop fully, leading to problems with blood circulation. In addition, this technique is also used in the following cases: trauma to the abdomen and or lungs. Abdominal aortography helps determine the location and severity of injuries, aiding in timely surgical treatment. In addition, this technique is also used in the following cases: tumors in the abdomen suspected of compressing or invading blood vessels. Abdominal aortography helps determine the extent of the tumor's impact on blood vessels, allowing doctors to devise appropriate treatment plans. In addition, this technique is also used in the following cases: organ transplantation surgery or interventional radiology. Abdominal aortography helps identify the location and condition of blood vessels, supporting surgery and interventional radiology procedures more effectively. In addition, this technique is also used in the following cases: patients with diagnosed abdominal aortic aneurysms. Abdominal aortography helps monitor the progression of the disease and assess the effectiveness of treatment. Step 1: Preparation. The patient is informed about the procedure and signs a consent form. The patient changes into a hospital gown, removes jewelry, and removes contact lenses. Medical history, current medications, drug allergies, cardiovascular diseases, etc., are checked. Step 1: Preparation. The patient should fast for 68 hours before the procedure, but water intake is allowed. The doctor will position the patient lying on their back on the imaging table and establish an intravenous line for contrast injection. Local anesthesia will be administered to reduce pain. Step 1: Preparation. In cases where the patient is agitated, fearful, or unable to cooperate, such as children under 5 years old, a predation medication can be administered for general anesthesia before the procedure. Step 2: Imaging. The doctor will choose the location and technique for inserting the catheter into the artery. Typically, the catheter is inserted from the femoral artery, and the Seldinger technique is used. Once the catheter is in place, the doctor will inject the contrast dye into the abdominal aorta. Step 2: Imaging. Digital subtraction angiography is used to capture images of the abdominal aorta and its branches as the contrast dye travels. The doctor will review the images, analyze the results, and draw diagnostic conclusions. Step 3: Post-procedure. The patient will be monitored for blood pressure, heart rate, and any abnormal signs after the procedure. The doctor may prescribe pain relievers and anti-inflammatory medication if necessary. The patient can be discharged after their health stabilizes. Step 3: Post-procedure. The doctor will explain the imaging results to the patient and their family and advise on appropriate treatment options. Note: abdominal aortography with digital subtraction angiography is a safe and effective technique for diagnosing and monitoring diseases of the abdominal blood vessels. However, the procedure may have side effects such as allergic reaction to contrast dye, pain, bruising, bleeding at the injection site. Note: artery damage from catheter insertion, allergic reaction to contrast dye, pain, bruising, bleeding at the injection site, artery damage from catheter insertion. Patients should inform their doctor about their medical history, current medications, drug allergies before the procedure. Note: the doctor will assess the patient's health condition and only proceed with the procedure if it is deemed safe. Allergic reaction to contrast dye. Pain, bruising, bleeding at the injection site. Artery damage from catheter insertion.